Osteoarthritis, it's the commonest joint disease. Basically, it's a degeneration of the articular cartilage with secondary underlying bone changes associated with swelling and of the joint and decreased mobility. At the end, we will have physical disability and immobility, okay? Most commonly, it is a primary disease, 95% of cases. Only 5% is secondary due to trauma, obesity, bone deformity, or underlying systemic disease. It is a disease of older age. Usually people with osteoarthritis are above 60 years. It affects oligoarticular, يعني a single group of joints, affects the hip joints, knees, and lower lumbar and cervical vertebra. It can affect also the distal hands joints, distal interphalangeal joints, and proximal interphalangeal joints of hands, carbometacarpal and first tarsometatarsal joints. The pathophysiology, it is research has found that it is related to what? Chondrocyte injury. When we have a chondrocyte injury, as a reaction, شو رح يصير في عنا repetitive repair and proliferation of chondrocytes. Also, بصير في عنا destruction, يعني it's like a repetitive process of repair, proliferation, and destruction. Ultimately, the destruction will predominate. We will end up with loss of the articular surface, the cartilage, and a bony deformity. طبعاً لازم يكون في عنا genetic background. Not all people will have osteoarthritis with age, صح؟ لكن age is a very important factor besides genetic factors and mechanical stresses. So it is a repeated cycle of repair that will lead to imbalance in the expression, activity, and signals of growth factors, will lead to degeneration of the cartilage and the matrix in the synovial fluid, اللي هو بصير في عنا increase in the water content, decrease in the protoglycan, and decrease in the collagen type 2. This will lead to cracking and loss of the cartilage surface, okay, superficial cartilage loss, which is called chondromalacia, loss of the articulating cartilage. After that, إيش بصير؟ بصير exposure للsubchondral bone. البون بصير exposed للarticulating surface، وهو مش مهيأ لحتى يكون articulate، يعني direct articulating surface، okay؟ فإيش بصير بالبون with time؟ بصير في عنا erosions, destruction, and fractures. This will give the bone with the continuous friction what? The appearance of polished ivory. بيكون glistening. بنسميه bone hibernation. Okay? This will stimulate the osteoplastic activity and lead to osteosclerosis. هلا لما يصير في عنا destruction cartilage into small pieces, also small bony fragments within the articulating area, we call it joint mice, okay? تكون small pieces circulating in the fluid. Also, بسبب the cracks والclefts in the bony surface, بصير في عنا leakage of the synovial fluid through these clefts and formation of subchondral cyst. يكون فيها synovial fluid. كل هاي manifestation, gross manifestation للأوستيوارثرايتس. ممكن كمان as a reaction حكينا بصير osteoplastic activity and bony outgrowth in the form of osteophytes. فالosteophytes, subchondral cyst, joint mice, bone hibernation, chondromalacia, كل هاي عبارة عن terms describing the situation in osteoarthritis. As you can see here, we have subchondral cyst. Here you can see the bone hibernation, بيكون ivory glistening surface. Okay. We can see loss of the articulating space. يعني المفروض يكون في space between the two bones, representing the articulating synovial synovium. Okay, ففي عندنا loss of this space, of the normal space in the joint. Clinically, patient presented with slowly progressive symptoms, joint pain that worsens with use. هاي very important عشان نفرقها عن rheumatoid arthritis. Worsens with use يعني فبيكون البين بيجي تقريبا at the end of the day خلينا نحكي or after activity. Okay? Swelling, crepitus اللي هي ايش؟ Sound of moving the joints بيكون في زي طقطقة أو sound related to abnormal joint movement. Limitation of movement. Okay? ممكن it can lead to a permanent or progressive deformity in the joints, but there is no ankylosis. كمان هاي بنفرقها عن rheumatoid arthritis. Ankylosis اللي هو عبارة عن fused bones or joints. بتكون fused فبتؤدي ل limitation of movement. This feature seen in rheumatoid arthritis. Okay? Osteophytes اللي هم البوني outgrowth من around the joint can lead to what? Can compress the nerves, and the patient present with a neural manifestation and muscle spasm, muscle atrophy, and neurologic deficits. Heberden notes at the distal interpharyngeal joints عبارة عن masses formed around these joints in the fingers. Okay. Treatment with analgesics, physiotherapy, and joint replacement. Rheumatoid arthritis, the second type, it is an autoimmune disease. لما نحكي autoimmune, most likely seen in women. Okay. Middle age, it's a chronic and systemic disease, not only affecting the joints, other organs can be affected like blood vessels, heart, and others. It affects principally the joint, okay? It is a polyarticular involvement. The multiple joints can be involved. في osteoarthritis, it is oligoarticular. ممكن at the end أو خلينا نحكي after long term can other joints or multiple joints affected بالاosteoarthritis. The rheumatoid arthritis, it is a polyarticular involvement disease. Characteristically, it affects the small joints of hands and feet, sparing what? The distal interphalangeal joint. هاي بنشوفها وين؟ في الاوستيوارثرايتس distal، لكن البروكسيمال والميتاكاربوفالنجيال joints involved by rheumatoid arthritis. Swelling زي أي inflammation, warm, painful joints. Any peripheral joints also can be involved مثل الهيب والaxial involvement later on, but it is rare. Okay? الextra articular site حكينا heart, lungs, skin, blood vessels, muscles ممكن can show manifestation of rheumatoid arthritis. Pathogenesis, it is related to مثل autoimmune diseases, abnormal immune response, usually affecting genetic pattern اللي هو HLA class 2, BTPN22. And it is related to also environmental factor اللي هي بتعمل triggering، يعني بيكون عندنا genetic predisposition استعداد جيني with environmental triggers اللي هم like infection, smoking, also menopause اللي هو loss of estrogen in females. هدول triggering factor to initiate the inflammatory process in patients with genetic predisposition. Autoantibodies seen in rheumatoid arthritis اللي هم rheumatoid factor والanti cyclic citrullinated peptides, anti-CCP. Okay? Either one of them or both of them can be found. This will stimulate the T helper cells, especially CD4 cells, T helper cells, to secrete interleukins 1, 6, 8, 17, and tumor necrosis factor. That will lead to what? it will lead these cytokines and signals secreted by the T helper cells will lead to activation of leukocytes and macrophages. This will lead to tissue destruction and chronic inflammation. The other thing, من signals, will lead to stimulating the synovial cells and fibroblasts. So we will see these synovial cells بصير فيهم proliferation, فبيعملوا papillary growth, okay, the synovial cells, and also secrete proteolytic enzymes that will lead to more tissue destruction along with the inflammatory cells. بالتالي under the microscope راح يكون في عندنا chronic inflammation, plasma cells, lymphocytes, plus proliferation of the synovial cells and the fibroblast in the form of chronic papillary synovitis, inflammation with papillary growth. With time, this will lead to pannus formation اللي هي outgrowth. خلينا نحكي nodules with papillary proliferation lead to something called pannus formation, which is villous projections composed of hypertrophied synovium, fibrosis, and granulation tissue and inflammation. Okay, this growth can extend to intra-articular space and lead to destruction of the cartilage and bone. And the pannus will fill the joint spaces with more fibrosis and ossification. Okay, if it fills the articulating surface, this will lead to ankylosis اللي هو fused joints, فبالتالي ما في immobility, unable to move the joints, and joint deformity. الانكايلوسيس ما بنشوفها بالاوستيوارثرايتس اللي حكينا عنها من شوي. هلا هون under the microscope من الكاركترستيك للروماتويد ارثرايتس اللي هو الليمفويد تيشو diffuse lymphoid tissue placement with papillary synovial cell proliferation. Okay, this is the pannus formation اللي هو related to the granulation tissue inflammation and the papillary synovial hyperplasia. Other manifestation of rheumatoid disease, rheumatoid arthritis اللي هم rheumatoid nodule. These nodules are subcutaneous nodules. It is not common. Seen where on the extensor surface of the forearm, seen in 25% of patients with rheumatoid arthritis. Under the microscope, عبارة عن fibrinoid necrosis aligned by what? Macrophages, surrounded by macrophages. Okay, فهون في عنا at the center necrosis and surrounded by a rim of macrophages. And هون هي grossly زي ما حكينا على extensor surface of the forearm. Clinically, it's a progressive, slowly disease. It has the course of what? Relapsing and remitting. يعني في periods of symptom-free periods. Okay. Joint pain following inactivity. Okay, يعني after rest. فهذا وين بنشوفهم rheumatoid arthritis البين بيكون عندهم early in the morning بعد نوم. after immobility أو inactivity بيكون في pain بالjoints على عكس osteoarthritis. Also, there is swelling with time will lead to deformity in the joints and ankylosis. اللي حكينا fused joints and immobility in the joint. طيب. Associated also with hand changes, يصير في عندنا radial deviation of the wrist and ulnar deviation of the fingers. Also with flexion and hyperextension abnormalities of the fingers called swan neck deformity or boutonniere deformity and boutonniere deformity. هم التنتين. Okay? في flexion and hyperextension in the fingers. Type diagnosis based on clinical picture history and physical examination plus elevation in the titers of rheumatoid factor or anti-CCP antibody. Treatment with corticosteroids, methotrexate and anti-TNF antibodies. هون السوان neck and boutonniere deformities in the fingers. Okay. في عنا radial deviation of the wrist to the radial side and ulnar deviation of the metacarpopharyngeal joints. طيب هاي اللي هي السيرونيجاتيف erythropathies. Seronegative erythropathies عبارة عن a group of diseases, not only one disease. The prototype of this group هو ankylosing spondylitis. Okay, مثال عليها. Characterized by absence of rheumatoid factor. لما نعمل التايتر ما بيكون في elevation بالrheumatoid factor. Pathological changes in the ligamentous attachment rather than in the synovium. Involvement of the sacroiliac joints, characteristic to this group of diseases, associated with the HLA-B27 phenotype, bony proliferation leading to ankylosis as well. And زي ما حكينا البروتوتايب أشهر مثال عليها أو the most common of them هم ankylosing spondylitis. طيب هلا هون الكريستال related erythropathies في عنا two diseases نفرق بيناتهم الجاوت والزودوجاوت. الجاوت related to deposition of uric acid crystals اللي هم monosodium urate. These crystals, the shape of them are needle shaped, negatively birefringent on the polarized microscope. يعني بالcertain microscope في terms اللي هي negative birefringent. It can deposit in the body fluids, in the synovial fluids, example, and in other soft tissues. Not all patients with hyperuricemia will have gout, okay? It's seen in 10% of people with hyperuricemia. Hyperuricemia when the uric acid more than 6.8 milligram per deciliter. Okay, it is much more common in males and in middle age above 30s. طيب هلا لما يصير كيف بده يزيد عنا الليفل of uric acid؟ either be increase synthesis or decrease the excretion. السynthesis هي basically هي one of the products of purine degradation. البيورين اللي هم من النيوكليوتايد الادينوسين والجوانين، اوكي؟ لما يصير في عندنا turn over بصير في عندنا destruction للادينوسين والجوانين من one of the products هو اليوريك acid. طيب هلا certain diseases certain مثلا enzymatic or metabolic diseases بصير في عندنا build up of uric acid due to synthesis, but this one is rare or less common. More common اللي هو decrease in the excretion, فبصير في عندنا build up of uric acid in the body. So it is decreased excretion, which is of unknown cause. Why we have decreased excretion? بتكون الكدنيز they are fine, لكن بصير في عندنا build up of uric acid due to decreased excretion. 90% it is primary حكينا without associated disease. و 10% secondary. Secondary to what? For example, patient with rapidly progressive tumors مثل leukemias بصير في عندهم turnover للسيلز كبير, especially if they take chemotherapy, فبصير في destruction للدي ان اي للسيلز وريليس للنيوكليوتايدز and more production of uric acid. هدول بنسميهم secondary causes. ولكن the most common it is primary related to reduced excretion. Also من the secondary causes renal failure لما يكون في عنا kidney problem and thiazide diuretics. This diuretics can lead to build up of uric acid or decrease excretion of uric acid and associated with gout. Treatment and said اللي هم general analgesics and certain drugs that lower the urate level مثل xanthine oxidase inhibitor. طيب للpathophysiology the crystal في 4 stages the gout. Crystal deposition first of all in the synovium will induce acute inflammation. The patient بيجي acute arthritis, painful swelling, redness, hotness involved joint. التوفاي اللي هي pathognomonic for gout في صوت خلص. اللي هو الباثوجنومينيك for gout اسمها tophus formation or tophi. This seen in the joints, can be seen also on the earlobes and nose or fingers. شو بتكون من ايش التوفاي؟ عبارة عن large urate crystals surrounded by chronic inflammation and giant cells. نوع giant cells بيكون foreign body giant cell reaction. The third stage اللي هي repeated attacks of arthritis and crystal deposition that lead to large crystal formation اللي هي composed of tophi, chronic inflammation that will lead to joint destruction and ankylosing deformity in the joints. The fourth stage اللي هي النفروباثي. gouty nephropathy بتكون في عندنا tophi, deposition of uric acid with inflammatory reaction and stones, calculi in the kidney and pyelonephritis, inflammation in the kidneys. This is an example of the tophi, the deposition of uric acid with tissue reaction. هاي pathophysiology, and here the stage اللي هم asymptomatic stage, acute stage, ممكن كمان intercritical period of asymptomatic symptom-free interval and chronic tophaceous gout. After repeated attacks, 4 years can lead to chronic gout involving multiple joints. The most common joint affected in gout اللي هو the first metatarsal pharyngeal joints اللي هو of the big toe. Okay? طيب. الpseudo gout on the other hand, type of crystals involved هم calcium pyrophosphate crystals. It deposited in the cartilage. It could be sporadic disease or hereditary, and we have secondary forms related to hyperparathyroidism, to hemochromatosis and diabetes, seen in older age group above 50. It has the same pathology, pathophysiology to gout, but it has a less severe, milder form of inflammation. It involves the knees more than other joints. The shape of the crystals are rhomboid. Okay, بالgout حكينا needle shape, and it is positively birefringent with the polarized microscope. There is no known treatment that will prevent the disease or slow the formation. طيب. هلا tumor-like lesions that affect the joints. رح نحكي عن two examples. Tumor-like فهم مش truly tumor لكنهم masses. Okay? Ganglion والsynovial cyst. Ganglion عبارة عن small cyst arises near the tendon or joint. Related to myxoid degeneration of the connective tissue. There is no lining in the ganglion compared to the synovial cyst. Synovial cyst, it has a lining, no synovial cells. There is no lining, and most common site to be involved with this cyst اللي هو wrist. Synovial cyst, it is a herniation of the synovium through joint capsule, basically, and that lead to massive enlargement of the bursa. البرسا اللي هي واحدة من الكوشنز اللي بتكون بالجوينتس. Example عليها البيكر cyst. الcommon site إلها at the popliteal fossa. طيب هلا في رح نحكي كمان عن tumor involving the joints. A true tumor, but it is benign most of the time. Very rare to have a malignant association. اللي هو tenosynovial giant cell tumor. It is associated with translocation 1, 2. We have two subtypes. Diffuse type of tenosynovial giant cell tumor or localized type. The diffuse type involving mainly affect the knees, and it is painful tumor. It can be large, aggressive, and associated with recurrence rates after excision. Localized type, it's a small circumscribed mass, painless, affecting the hand tendon sheath. Okay? Under the microscope both of them almost the same. عبارة عن neoplastic cells اللي هم mononuclear cells polygonal resembling the synovial which is minor component of the tumor. The other component اللي هو multinucleated and hemosiderin laden macrophages. تقريبا بيشبه الجاينت سيل تيومر اوف بون من ناحيه الكومبوزيشن بتكون multinucleated cells plus mononuclear neoplastic cell which is the minor component of the tumor. هلا هون السوفت تيشو تيومر. اوكي. طيب اللايبوما اوكي اللايبوما هي commonest soft tissue tumor. It is solitary usually in the subcutaneous tissue or proximal extremities and the trunk. It could be multiple in familial cases. It is not a pre-malignant tumor. ما راح يكون عندنا لايبوما وتتحول للايبوساركوما. Okay. It is a grossly circumscribed, well-defined mass, yellow in color, reflecting the fatty component in the lipoma, composed of mature fatty tissue surrounded by capsule. هذا اللي بيميزها عن أي fat tissue موجود بالجسم إنه it has a capsule and forming a mass. لكن هي عبارة عن mature adipocytes. Okay? Cured by simple excision. On the other hand, liposarcoma affecting older age, location in the deep soft tissue in the thigh and retroperitoneum, deeply located, older age, under the microscope the characteristic اللي بندور عليها to diagnose liposarcoma اللي هو the presence of what? Lipoblasts اللي هم immature lipocytes. كيف بيكون شكلهم؟ اللايبوسايت normally خدتوا بالهيستولوجي بتكون eccentrically located nucleus صح؟ at the rim, at the periphery with large big vacuole. شيء؟ اللايبوبلاست بتكون centrally located nucleus with multi-vacuolated cytoplasm. فاللايبوبلاست هي characteristic لللايبوساركوما. طبعا هذا كله كلام general يعني لو بدنا ندخل بالتايبس in each of them ده في exceptions لكل لللايبوساركوما ولا اللايبوما. طيب اوكي now الفايبروماتوسيس اللي هو fibroplastic tumors fibromatosis. It is infiltrative fibroblastic proliferation associated with recurrence rate, okay, after excision, but do not metastasize. We have two types. We can divide them into superficial fibromatosis and deep fibromatosis. Superficial one examples: palmar deputerine contracture, palmar fibromatosis associated with contracture, okay. Plantar fibromatosis not associated with contracture and benign disease. Deeply located fibromatosis, the other name is desmoid tumor. It's deeply located in the soft tissue of abdomen, trunk, and extremities. It is more common in females, desmoid tumor, associated with mutation of beta-catenin or ABC, اللي هو adenomatosis polyposis coli, okay, adenomatosis polyposis coli gene. Could be sporadic or associated with Gardner syndrome. Gardner syndrome اللي هو one of the ABC gene syndromes, okay? واحد منهم اللي هو Gardner syndrome. It is more aggressive, of course, if we compare it with the superficial fibromatosis. The deep one is more aggressive. ممكن يكون destructive to the site اللي هو موجود فيه بيعمل destruction. Recurrence rate بيكون عالي. طيب هدول اللي انا بفشك عنهم صور صح بس يعني اوكي. طيب هاي اللي هون رح نحكي عن الساينوفيال ساركوما.
لا فايبروساركوما.
ايه
فايبروساركوما.
فايبروساركوما اوكي. الفايبروساركوما اللي هي المالجنانت فايبروبلاستيك تيومر. Sarcomas affecting the old age, deeply located, and in histology it has fascicles of atypical fibroblasts, fascicles resembling arranged towards the herringbone appearance اللي هو مثل الفيش بون. Okay, arranged in this arrangement. اللايومايوما هو البناين tumor of smooth muscles, mainly seen in the uterus or in the soft tissue. Leiomyosarcoma, the same thing, uterus or soft tissue. It could be superficial or large, deep retroperitoneal involvement or extremities. Three parameters to differentiate: is it benign, tumor, or malignant? اللي هي pleomorphism, mitosis, and necrosis in terms of leiomyosarcoma. الskeletal muscle, البناين tumor منها اسمه rhabdomyoma, which are red tumors, and the malignant one are rhabdomyosarcomas. It is commonest sarcomas of children and characterized by the presence of rhabdomyoblast, which is the primitive skeletal muscle cells. It has the tadpole appearance or strap cells with striation. We have three types من rhabdomyosarcomas: imperial type, alveolar type, and pleomorphic type. Most common of them اللي هو imperial type, and it is worst prognosis. Okay? Sites للimperial, head and neck and genitourinary areas. Alveolar translocation associated with translocation 213, 113, seen in extremities more. And pleomorphic seen in older age group, in adults. Treatment, surgery, and chemotherapy. طيب هاي الساينوفيال ساركوما misnomer لأنها not related to the synovium cell of origin is not the synovial cells. Okay? Affect middle age patients بيكونوا 20 to 40s, deeply located around the joints, also especially the knees. Translocation in synovial sarcoma X18. Histology, it is biphasic or monophasic. Monophasic بتكون only تشبه الفايبروساركوما, only fibroblasts. Okay. البايفيزيك بيكون في عنا two, بيكون في عنا glandular formation and stromal cells, spindle cells. Associated with lung and lymph node metastasis and treated with surgery and chemotherapy.
نلحق محاضرتنا.
يعطيكم العافية.